I would have preferred, to tell you the truth, a single-payer plan. A Medicare for all. It would have been much, much simpler to do it that way. And I think there's an irony here, because the actual plan that we found, that we got, the Affordable Care Act, is modeled after a plan that for years Republicans have been pushing in contrast to affordable care in terms of Medicare for all. That is, there were two plans, and I remember this in the 1990s when Hillary Rodham was in charge. Hillary Rodham Clinton was in charge of coming up with her version of health care, and there were the competing plans. One was Medicare for all, modeled on Medicare, modeled on Social Security, government as single payer, and the other was the Republican plan, which was you rely on private insurers, and you have a mandate, and you do all of these things. And the second just seemed too confusing, but to get Republican support, Obama went to the confusing plan and got no support. Politics comes from the Greek root poly, meaning many, and ticks, small blood-sucking insects. So Medicare, I think with the Affordable Care Act, we are going to see some more preventive care. There may be some help with regard to, and it could be that those healthcare costs are beginning to level out, maybe because so much attention is being paid to the healthcare system and healthcare costs. I don't know. We don't know yet. But I also know, I do know, that there is also simultaneously a private pension crisis brewing. A lot of people have not saved. A lot of people who are facing retirement have not saved enough. Part of this is because of the Great Recession that nobody expected and nobody planned for, a decline in housing prices. Part of it also is that baby boomers, well, I don't want to overgeneralize, but we are a little bit self-indulgent. Well, the point is we didn't save enough and haven't saved enough. And I go around the country conducting a kind of free-floating focus group, asking people, mostly boomers, early boomers, what kind of retirement do you expect when you retire? And what I get back from them is a version, what I call a med-med retirement, kind of a cross between a Club Med and a medical facility. You know, snorkeling in the morning, extra oxygen in the afternoon. That med vision that people have is not possible. There's no way that this society can afford that for the baby boomers. The other thing you need to understand, and this particularly affects adult day services, and in fact, all of our kind of caring professions, as the population ages, there are fewer and fewer people left behind to take care of the aging population. About 35 years ago, according to the Census Bureau and census data, there were roughly 4 Americans for every retiree. Now we're down to a little over 3 working people for every retiree. And if we keep on going in the direction we're going, in 15 years, we'll be down to around a little over 2 working people for every retiree. Well, those 2 working people presumably have got to do more than take care of the retirees. Do you get the problem? So what are we going to do? Well, one thing we might do, in fact, we're already doing it. We're doing it in a kind of backwards way, but we're going to have to do it, not just to take care of retirees and elderly people, but also to make sure that the economy continues to move forward, is we are going to have more immigrants. But let me explain to you that and this is true of Europe, it's true of Japan, it's true of China, whenever you have countries that have rapidly aging populations, they are going to have to inevitably turn to mostly developing nations that have large numbers of young people. I mean, this is going to happen whether these rapidly aging populations like it or not. It's already beginning to happen. It's going to happen legally or illegally. It's going to happen. The one big benefit we have in the United States is we are a nation almost entirely of immigrants, And we know how to assimilate. We know how to do it. Europe doesn't really know how to do it. Japan certainly doesn't know how to do it. China doesn't know how to do it. So we have a great advantage in terms of being a country that is more or less open to young people, ambitious people from around the world. One thing that a lot of those right now in the immigration debate are not paying attention to is immigrants, when they come here, and this is true of your parents or grandparents or great-grandparents and mine, one attribute that they have, even if they don't have much education, the mere fact that they made so much of an effort to get here means that they have one thing that is critically important, and that is ambition. And that's what we see over and over again with regard to immigrants, new immigrants. So it is not something to be feared. It's something to be managed, but it's something to be, at the same time, invited.